Hello, Melamed community. We are back. It has been a minute, but we haven't forgotten you. We just took a little hiatus, didn't we?
Just a little bit, but we're excited to be back and glad that you're on board with us. And, we want to encourage you to have your friends subscribe and share and be a part of the family as well.
So I am Dr. Norma Mobley along with Dr. Dixon, and today we will be touching upon compassion fatigue. I don't know how many of you have heard this particular term, but it is a real and significant issue, particularly for women of color in medicine.
Absolutely.
As we have to also encounter systemic and cultural burdens in addition to our everyday, day-to-day activities dealing with illness, pain, and suffering.
Right.
We also have institutional aggressions and things that we have to encounter as well.
And I think the other thing that we have to encounter is our own families. You're the doctor in the family, so you're the doctor in the family. And so we have to deal with it.
And then you become the expert on everything, right?
Everything.
So I'm a pediatrician, but I get calls about ophthalmologic questions.
Yep.
I get calls about dermatology.
Heart disease,
everything.
Any and everything, because you are the doctor.
Right. So we're going to try to delve into this, and why don't we start out by just giving a brief definition of what compassion fatigue really is.
Okay, please do.
It's often coined as the cost of caring, and that means the emotional toil that it takes upon you providing care for patients. It's a state of emotional and physical exhaustion resulting from chronic use of your own empathy in a professional capacity. So this is different from physician burnout,
right?
Which is that physical burnout or exhaustion just related directly to workload.
Right.
This is your emotional exhaustion.
And we're probably not the only, we know we're not the only profession that happens to. So this really applies to us across the board. This can happen in a number of professions.
Right. This is compassion fatigue is directly related to that engagement of empathy on an ongoing basis at different levels with all of your patients. It's not always in regard to pain and suffering. Sometimes it's dealing with their mental well-being. And there are certain specialties, of course, for example, hem-onc or surgical professions where you may have to deal, or trauma, where you're dealing with this even more ongoing at a day-to-day high intensity level.
And a little different than other professions. We are usually dealing with not just the patient, but the patient's family. And certainly in pediatrics, we're always dealing with the entire family. But even in adult medicine, like you said, it depends on who's having the surgery, that there are multiple folks that you have to deal with. And in different cultures, like ours, where there's a lot of extended family that come and want to get more information or want to grab you in the hallway. And you end up talking more than you had planned.
So I just had an experience this week taking care of one of my 10-year-old patients. We're dealing with her health and weight management issues. And the grandmother asked me, could I check her hemoglobin A1C too while she was there? And I said, I'm sorry, but you're not my patient. I'm not able to do that for you. But they feel very comfortable asking.
Yes. And that makes you feel like, maybe I should do that. But, that's something we can't do.
No, that's something we cannot do. So what are the symptoms? How do we recognize compassion fatigue? So these are the symptoms: emotional exhaustion, decreased empathy capacity. So you will find that you're becoming numb, if you will, to your patients. Your level of caring has lessened, where you're not able to provide that same level of compassionate care to your patients. Irritability. That's with those that are close around you, though. Feeling hopeless, difficulty concentrating, sleep disturbances. That would be difficulty falling asleep,
Right.
difficulty maintaining sleep.
Right. And always thinking about, sometimes I have done that where I'm thinking about the issues when I'm trying to get sleep. And you don't realize that you're not really getting the sleep that you need so you can function during the day.
Right.
Yeah.
So headaches and general fatigue, as well as withdrawing from others. And if you think about some of these symptoms, irritability, problems with sleep, withdrawal, all of these carry you down another pathway that could perhaps lead toward depression.
Yeah. Yeah.
So you really want to recognize this before it gets that deep.
Right, right. Now, I will tell this little story because I don't think it's compassion fatigue, but my kids would say it is. Now, my kids look at me when they tell me they've got a boo-boo, and I'm like, well, or something hurts. And I say, well, stop moving that. Or why you? And they always say, Mom, I don't see how did you get to be a pediatrician? Because you never say anything. You never believe us. Well, what is your own family members?
Right.
But it's not that I'm not compassionate. I'm just your mama. I know better. But, we have to recognize, so maybe I'm not being as compassionate as I can be, even with my own.
With your own
family.
children. That's true. So when these symptoms are present and they go unaddressed, or you don't recognize it at all, it's going to manifest professionally.
Yeah.
So it's going to impact the level of patient care that you provide. And you will also begin to experience professional dissatisfaction, no longer being as happy with whatever your role is as a healthcare professional.
Right, right. And of course, it crosses over into the nursing profession, into those who are in physical therapy, or occupational therapy, any kind of medical fields. You really do are at an increased risk.
Right.
Of compassion fatigue, and you need to recognize it.
And it results in overall decline in your personal well-being.
Absolutely. So I think, what can we do? We recognize the symptoms. So what are the suggestions for what do we do to avoid that, or to make sure that we are addressing?
So there are some key factors that we need to look at on how to combat compassion fatigue. But I'd also like to, just for our Melomed community, I'd like for us to look at why we are uniquely impacted. Why is it different for us? So you brought up part of it in regard to family dynamics.
Yes.
So you would say, well, any woman in medicine who has a family, they're a mother or a daughter, they would have the same experience. However, there are some systemic undertones that feed into our compassion fatigue that others may not experience. For example, being identified as the individual, for example, to implement diversity within your work setting or to develop diversity initiatives.
Yes.
Also, perhaps you are the only person on your team who has another language that you speak. So every time someone from your same culture shows up, they're coming to ask you to come interpret. So you're being pulled from your responsibilities to go help a colleague communicate with their patient. So you're helping them with their workload while yours is piling up. And oftentimes we are given these additional responsibilities without any added compensation.
Right.
Or without any recognition to compensate our time.
Right. And we're not asked.
No, we're not asked.
It's assumed that you would want to take this on, or that you are the best person to take it on. You might be the best person to take it on, but giving you an opportunity to decide, how, when, how long are important. And we have to speak up for ourselves and say that.
Right. There's also those unspoken pressures that are there. I'm certain you've experienced it from time to time. And many of you out there who are listening and watching, you may have experienced it as well, because you may be the one and only, or one of very few who look like you within your team of coworkers, your peers, your colleagues, and you're deemed the expert on whatever culture you represent.
Right.
And you're the representative for everyone. So it's like, well, whatever you do or say spills over to everyone else. And we're all individuals.
Right, right. And sometimes, though, we take on things ourselves because we feel bad, or we feel like we should help. I have a story from residency where I had this kid. Everybody knew the kid because he spent a lot of time on the service. He was a kid who had a significant liver disease. And when he would come in, though, he would come in and parents would leave. And so he would be there essentially by himself. And, you would hear little things like, well, his mom, she came in for a few minutes and she's gone. But I knew this mother was working, and she had other kids at home. And so when I was on call, I would stay in this little boy's room all night long. I didn't go to the call room or, in front of the television or anything, and I would be up with him. And, people would notice that, like, gosh, you just stay with him every night? I'm like, yeah, he doesn't have anybody here. But that's something I took on.
Right.
Yes, I was sleeping the next morning.
Oftentimes we do that. We feel compelled to do it. We extend ourselves because no one else will. So we do things with our patients and within our community because oftentimes we are that go-to person.
Absolutely.
We're the only one that can speak out on certain aspects of what's going on in our community.
And depending on where we're working, who we're working with, we sometimes have a different view of why a mother may not be there, like I did, or why a family might need us a little bit more.
Right.
That other colleagues may not understand. They may put off on their being lazy, or they're not, they don't care enough. And we know some of the underlying things that are causing them to make the decisions that they're making.
Right.
We just extend ourselves more.
So think about this. This is another systemic thing within training for years. So think back to, and we have to be very careful not to take some of that on. So think back to the differences just in pain management between cancer patients and patients who have sickle cell disease.
Right. Very different. It was very different.
Very different.
Very different.
The patient with sickle cell and pain, in true pain, was often categorized as drug seeking.
Right, right.
Whereas someone with leukemia or some other type of cancer was considered to really be in pain, and they received more compassion about their pain.
They did.
And their management was more deliberate and diligent than it was for those who had sickle cell.
Right, and sickle cell patients look like who?
Look like us.
Look like us. And so, yeah, you're right. It's a difference in not only the disease process, but who gets the disease, who's telling you that they're having this difficulty. And again, you're there trying to be the advocate,
right,
for them, because you know that there is a clear difference being made.
Right. So let's take a look at what we can do. One more thing I wanted to mention is culturally, especially for us, and there are other cultures, but I can speak for my own experience, that term strong Black woman. Everyone looks at you and feels like you're able to endure and overcome whatever you encounter, which oftentimes results in you internalizing the stressors that you're experiencing. And again, a lot of times we put that on ourselves.
Right.
Just because we're reared that way.
Right, absolutely. And it's been a common thing in our community.
Right.
But again, like you said, trying to recognize when that happens and making sure that we are attentive to ourselves is important. So for those who are coming behind us, you know, young medical students, young in your profession, you know, that's why we're here. We are wanting to make sure that we help you to think about these things while you're growing in your profession or growing in your lives, so that you can make sure that you are healthy and that you are, once you get on this other side, I keep saying this other side, I didn't know I was on the other side, but we're on the other side.
Okay.
Well, once you get to this stage of your life, you're not just now
Right.
recognizing things that you should have recognized
I feel
earlier.
like we're more in the middle. We haven't gotten to the other side yet.
Yeah. Okay.
We're in the middle. We're still going through.
There we go.
That's right.
There we go.
So once you've learned how to recognize the signs and symptoms of compassion fatigue, here are a few tips to help you combat it. So the first thing you have to do is recognize and set boundaries for yourself and realize this is non-negotiable. Do not compromise yourself. You have to prioritize self-care. So that means the physical, getting enough sleep, the right kind of nutrition, getting regular exercise. Doesn't have to be anything major or extensive, just going for a walk 3 times a week. Set your day and make sure you stay on that schedule and make sure you're getting that exercise, getting your endorphins revved up. The mental has to be addressed as well. So mindfulness, we're going to talk about, like we talked about, breathe, balance, and bloom.
That's right.
Okay?
That's right.
We're going to continue to do those type of things. Address and focus on your prioritize your emotions by participating in things that you enjoy, hobbies, family time that does not require more empathy and compassion, but fun, joyful activities with your family.
Yes.
But again, setting those clear boundaries for your personal time, setting them for yourself as well. Don't go home and start checking emails. Don't take the charting home.
Oh, Lord.
Leave it at the office. Once you get into checking emails, hours can go by.
Hours, just like when you're scrolling with your TikTok and all of that, hours can go by. And it's so difficult now that we're on electronic health records. You know, most of us are taking our charts home to finish, you know, but we have to still give ourselves some boundaries there of how long this is going to be. It's going to be 2 hours, and then you're going to stop and do other things. So we just have to do that for ourselves, or you'll be up all night with your charts.
And the last but definitely not least, develop that support network.
Yes.
Like we're trying to do here with you for Melamed. Okay?
Yep.
We want you to establish those mentors and allow them to pour into you and learn from them. As well as connecting with your peers and your colleagues, sharing your experiences, just being able to unload oftentimes will relieve the stress.
Absolutely.
And being able to share it with someone who already understands what you are going through makes it a lot easier.
Yes. Yeah, so that'll do it.
That'll do it.
You know, what else can we say other than I sure am glad I have you here.
I am too.
My friend, to help me control that.
And having that good friend is great, but don't set aside professional therapy as well. If you feel that you're getting really deep into, you know, isolation, feeling alone, becoming very irritable and short with your colleagues or your family members and friends, don't be fearful of seeking professional therapy as well.
Right. And don't be fearful of letting your colleague, your friend know that you've noticed something a little different. Sometimes we don't notice it, but we need a friend to tell us, you know, or ask the questions. What's happening? There's something going on.